Hey everyone, it's Tim and Jack, and this is our video on posture and stretching. If you're interested in getting a little taller, getting rid of certain aches and pains, reducing the risk of injury, and even reducing the risk of disease, you need to check this video out right now.
So, anyone can benefit from stretching, but if you want to be able to improve your posture and get rid of those aches and pains and reduce your risk for injury, you just need to stretch. It doesn't matter if you work in an office, if you're a weekend warrior, or you just do yoga in your spare time. Stretching is great, but remember, you don't have to be so flexible that you can turn your body into a pretzel or fit inside a suitcase. The most important thing is to make sure that you're able to keep your body in balance, and by reducing and limiting tight muscles while strengthening those weak and elongated muscles. A lot of people actually make the mistake of stretching muscles that don't even need to be stretched. So if you're stretching correctly and you don't feel that tightness, that muscle doesn't really need to be stretched at all. But just like any kind of exercise program, everyone should have their individual flexibility and mobilization program as well. For example, I might have a tighter chest than Tim, or he might have tighter hamstrings than I do. It just depends on the person, how they move, and how they live their life. If you live a sedentary lifestyle, you may be prone to having tighter muscles, and having a certain level of flexibility will only improve the quality of your life. A lack of flexibility can cause injuries while performing the simplest of tasks, whether you are picking something off the ground, reaching for something across your desk, or stepping off a curb. So just remember, the more mobile you are, the less injuries you'll get.
Okay, so growing up, you may or may not have had your parents constantly reminding you to stand up straight, and they were right. Poor posture can place abnormal weight on joints and stresses the muscles and tendons, often leading to pain. Poor posture is really bad for internal organs, fluid circulation, and creates an environment which is more favorable for disease. Muscles actually act as a pumping mechanism and can help circulate fluids throughout your body. So if this pumping action slows down or becomes less efficient by having poor posture and tight muscles, that fluid circulation becomes compromised and impaired. Poor posture, tight muscles, and muscle imbalances are a result of misuse and faulty movement. So what you want to do is address these tight muscles or imbalanced muscles before exercising. Long story short, you'll want to pretty much just loosen up all those tight muscles and strengthen those loose muscles with resistance or weight training to create a more balanced body.
Okay, cool. So thanks for tuning in to the stretching and posture informational video. Now what we'll do is we'll transition into just a few different assessments that both Tim and I use on our clients to really help them identify which muscle groups are tight and which muscle groups they should target when stretching.
Okay, so one of the assessments that we do is the plumb line test, and what we're trying to do is figure out if the individual has a tighter interior side of the body or the front side of the body, or tighter back side of the body. And ideally what you want to do is you want to look at the ankle, the knee, the hip, shoulders, and ear. And if you see this plumb line right here, you want to have all of those points directly in line with that plumb line. So most people tend to be more, they have more of a forward posture. So if you can round forward a little bit. This is kind of an exaggerated form, but people sometimes do have this posture right here. Typically you'll see that the shoulders round forward, they have a forward head carriage. And so this is going to tell me, and it's going to tell Jack, what muscles that person is going to need to stretch out and what muscles that person is going to need to strengthen to allow that person to become more balanced and a little bit taller and just improve their overall posture. So the next assessment that we do is a overhead squat assessment, and we actually use the plumb line with this one as well. So the position that Jack is going to get in is he's just going to put his hands over his head and then kind of fall into a normal squat pattern. And usually with this frontal view, looking at your feet, seeing if they splay out, if your feet collapse as well, if your knees collapse, and we're looking at any kind of shift in the hips as well, or any kind of rotation. So Jack, why don't you do about 3 reps? We usually have them do about 10, but just for the sake of the video, we're just gonna do 3. So let's do 3, and then if you can, just kind of exaggerate some of the improper ways of doing it.
Right.
Perfect.
Yeah.
Way to do it really poorly.
Thank you.
Okay. Now our second position is the lateral view, and what we're going to look for here is your ankle mobility. You're going to see if your hips tuck from under you, and then also if your arms are falling forward, if you have forward head carriers, or your shoulders are rounding forward as well. Then also looking for hyper or hypomobility in your lumbar spine, thoracic spine as well. So why don't you do a quick 3 again, and then if you can, try and screw it up as much as you can.
Here we go.
Jack.
Thanks again.
Right. And so for the last position, we're just going to want to take a look at the backside of Jack's body, and we're looking for a lot of those similar markers, looking for his feet, seeing if his ankles collapse as well, his knees again. We're looking for that tuck of the hips. We're also looking for any kind of shift again, and then if he has any kind of height difference in his shoulders, and also we're looking for any kind of rotational movements as well. So why don't you just do a quick 3 again, and then again, kind of screw it up as much as you can.
Perfect. Here we go.
Alrighty, thank you.
You're welcome. Thank you.
Yeah.
Alright guys, that is a wrap for the assessment video of both your posture and your flexibility. Those 2 assessments are both ones that Tim and I use for our clients, but there are a ton of them out there and a broad variety to choose from. But those 2 give us so much information and can really help you identify from your feet all the way to the top of your head on what muscle groups are tight and which muscle groups you should really address when you're composing that flexibility and mobilization program.
Alright, so thanks for checking out the video. We have a lot more videos to come, especially on specific stretches that you can do to help mobilize and help increase your range of motion and improve your posture as well.